Hey there and welcome. Today we're going to dive into a really fascinating approach to modern medicine, one that's kind of reshaping how we think about patient care. We're going to take a look at Arka Anugraha Hospital to see what their vision for integrative healthcare is all about and, what it might mean for all of us.
And this is the perfect place to start, right? When I say modern healthcare, what pops into your head? Is it all about the high-tech stuff, the gleaming machines, robotic surgeries, super advanced diagnostics? Or is it something else? Something maybe a little more human?
So, for a lot of us, it feels like you have to pick one. You either get the super high-tech clinical treatment or you get compassionate, holistic care that focuses on you as a person. But here's the big idea we're exploring today. What if you don't have to choose? What if the future of healthcare isn't about picking a side, but about bringing these two worlds together?
All right, so let's see how this whole philosophy actually plays out in the real world. We're going to kick things off by looking at how a place like Arka Anugraha Hospital manages to blend that cutting-edge, state-of-the-art medicine with a truly holistic approach to your well-being.
So here's their mission, plain and simple. Deliver modern medical treatment with compassion and precision. And you can tell this is about way more than just buying the latest gadgets. It's a promise, really. A promise to see you, the patient, as a whole person, not just a list of symptoms. It's all about those two words, compassion and precision.
Now, a big idea like this doesn't just pop up overnight, right? It's got to be built by people with a ton of experience and a really clear vision. So let's meet the pioneers behind this mission so we can really get to the heart of it. The architects here are Dr. Romesh Makum and Dr. Saraswathi Romesh. And these two, wow. For more than 30 years, they've been genuine pioneers in surgical care in Bangalore. Their combined experience, it's basically the backbone of this entire hospital. Let's start with Dr. Romesh Makum. Get this, we're talking over 45 years of experience. He's not just a surgeon, he's a true trailblazer, especially in stuff like minimally invasive surgery. And you know what that means for patients, right? Less pain and a much faster recovery. It's a game changer. And his impact? It's just huge. It goes way beyond the operating room. Through an institute he founded, he has personally trained over 1,600 surgeons from all over the world. Think about that. That's a legacy that just keeps on giving, spreading his expertise across the globe. Then you've got Dr. Saraswathi Romesh. She's dedicated over 40 years to women's health. Her expertise is in advanced laparoscopic gynecology. In simple terms, that means doing really complex surgeries through tiny little incisions. So again, you see that same focus, minimal invasion, better outcomes for the patient. And this is where it all connects back to that other half of the hospital's philosophy. See, Dr. Saraswathi isn't just an incredible surgeon. She's also a huge advocate for holistic wellness, for preventing problems in the first place. This is what brings things like yoga, naturopathy, and just proactive health right into the picture. It's that idea of prevention combined with surgical precision. Okay, so we've got this really powerful vision from the founders. But how does that actually look day to day for a patient? Well, it all rests on two main pillars, an amazing comprehensive team, and of course, advanced technology. Let's break them down. First up, the team. And the range of experts here really tells you everything you need to know. It's not just the specialists you would expect, in cardiology or orthopedics. What's absolutely crucial is that the team also includes an emotional wellness coach and an integrative psychiatrist. That shows you they're serious about treating your mental and emotional health as a core part of getting physically better. And pillar number 2 is the tech. This is the stuff that makes all this high-level care even possible. We're talking about the heavy hitters, 24/7 critical care, advanced ICUs with constant monitoring, and these super precise modular operating theaters. This is that modern treatment part of the mission in action for sure. All right, so the theory sounds great, but let's get practical. How does this all come together for an actual patient? We're going to use a really common and pretty painful health issue as a case study, kidney stones. This will show us exactly how this whole integrative approach works from start to finish. So first off, what even are kidney stones? Well, basically, they're these little hard deposits that form inside your kidneys. It happens when your urine has too much crystal-forming gunk and not enough water to wash it all out. It's a really simple imbalance, but man, it can be incredibly painful. Now, here's something you gotta know. Not all stones are created equal, and this is where that educational approach really shines. By figuring out the type of stone you have, is it from your diet, like a uric acid stone, or from an infection, like a struvite stone, the treatment plan can be completely customized, and even more important, so can a plan to stop them from ever coming back. And when you look at what causes them, one thing just jumps out at you. Yeah, diet matters, and sure, other medical conditions can play a part. But look at that biggest slice of the pie. The number one risk factor, by a long shot, is just not drinking enough water. Simple dehydration. And that's powerful to know, right? Because it's the one thing you have the most control over. It's a direct line from a simple daily habit to a pretty serious health problem.
Which brings us to the real goal here, the heart of this whole integrative idea. It's not just about getting rid of the stone and sending you on your way. It's about empowering you, giving you the knowledge you need so it never, ever comes back. And this is what that empowerment actually looks like in practice. 5 simple, doable steps. Notice there's no complicated medical jargon here. This is just straightforward, common sense advice. Drink more water, cut back on salt, eat your calcium-rich foods. This is how you turn a one-time treatment into lifelong well-being. You know, this old saying really nails it. Prevention is better than cure. It just sums up the whole philosophy. Real modern healthcare shouldn't just be about amazing cures for when we get sick. It should be about giving us the tools to not get sick in the first place. It's a total shift from being reactive to being proactive about our health. And that kind of leaves us with one last question to chew on. Think about your own healthcare. Is it all just about fixing problems after they show up? Or is it more of a partnership, one that's focused on building and maintaining your total well-being for the long haul? It's a question that honestly could change everything about how we look at medicine.